So welcome everyone. My name is Emily Ashley. I'm the Director of Citizen Information and Resources. I'll kind of act as the facilitator this evening. You all are kind of our faith-based congregation that we wanted to target for tonight's community conversation. So thank you for being here. Thank you for making time to listen to this presentation and be engaged. So I will introduce some of our VIPs. Dr. James Worsley, he's our Deputy County Administrator for Human Services. So Dr. Worsley, if you want to say hello.
Good evening, everyone. I'm at home, so I thank you, Emily. I don't feel like a VIP. You all are our VIPs tonight, so we're glad that you're able to take part in this very special meeting to talk about some of the very important things related to COVID. And Dr. Samuel is an expert in this area. He's certainly going to be able to provide you just that. So again, welcome and thank you so much, Emily, again for facilitating this this event on tonight.
Great, thanks. And next I'll hand it over to Dr. Samuel. He is our Health Department Director. He has been working tirelessly over the past year, first with testing and now with the vaccine. And he is just so impressive. And we're just so happy he's such a great partner to the county and everything he's been able to do. So Dr. Samuel, with that, I will hand it over to you and also share your presentation for this evening.
Dr. Samuel, you're on mute.
There, okay. Can you hear me?
Loud and clear. Yes, loud and clear.
So sorry about that, but yes, I just want to extend my thanks as well to everyone who's taking the time and effort out of their evenings to come and join us for this this time of, I hope it ends up being a conversation, certainly. And Emily did remind me, yes, it's been a year, pretty much exactly a year. I'm trying to think back. I think it was roughly about this time when we had our very first case of COVID in Chesterfield County. I can remember those days vividly as we were just trying to figure out what in the world was going on. And of course, there have been a number of different phases as we've all of us have worked together to respond to this pandemic. So I just want to begin by saying that I certainly deeply appreciate the important work that you do. I want to acknowledge that. I think you certainly are integral to the health of our communities. I think more so even in the work that I'm doing here in public health. So on this slide, Emily, if you could head to the next slide, please. Could you advance the slide? Thank you. Yep. So this is basically the outline I'm going to take tonight. I really just want to talk a little bit about prevention, kind of writ large, and then spend most of my time really talking about the vaccines themselves, just to kind of arm you with conversations that you might have and questions that you personally might have yourselves. And then talk about vaccine rollout in this health district. I know there have been questions about that. This has been a brand new endeavor. I certainly have never dealt with a pandemic before, and the last big one was about 100 years ago. So I pretty much plan to cover a very broad swath of terrain. Again, starting with vaccines, talking about rollout here in this health district, and then concluding basically with helping you all navigate the vaccine sign-up process, and then help your congregants do so as well. So next slide, please, Emily. Okay, so this is that big picture perspective I was hoping to kind of offer up at the very beginning. So I do believe that responding to this this outbreak has been the largest concentrated public health operation in U.S. history. I compare it to gearing up and fighting a major war. And we've gone through many battles already. I referred to the first one a year ago, and we were simply trying to figure out what indeed this virus was and how it behaved. It's been a very, very tricky adversary. And then moving on to putting up lines of defense like social distancing, testing, containment, which includes the contact tracing and case investigation terms I'm sure you've heard. And now we're finally able to offer, the stuff that will bring this thing to an end, ultimately, which of course is the vaccine. So the point of this rather busy slide is to show that vaccines are simply one part of the larger prevention puzzle. And many of the things that are listed on that slide will continue until we get enough people vaccinated and we learn more about the long-term effectiveness of the vaccine. Next slide, please. So I just want to offer up a little bit of background about vaccines in general, and then talk about some of the vaccine types that are out there to combat COVID. So essentially, a vaccine is a technology that primes one's immune system to fight off infection. And they've done incredible things in protecting human life. And I'd say next to food safety and clean water, they've contributed the most to extending the human lifespan. They're really bread and butter public health, again, technology or interventions. And again, they work by priming your immune system, by exposing it to a germ or pieces of a germ before you're actually infected by the germ. And since we're talking about COVID, here's basically the four major categories of COVID vaccines. So just, again, want to talk a little bit about each one of them and how they work. So if we go up to the left-hand corner there where it says genetic code vaccines, they basically introduce genetic material, which is the instruction manual for an organism. And it could be either RNA or DNA. And so this instruction manual tells your cells to start building and churning out protein that is normally found on the outside of the virus. And so when your body's defense system senses the viral protein that your body actually makes, it activates the immune system. And so the two kind of marquee vaccines that use this type of technology are the Pfizer and Moderna vaccines. And of course, I think those two words have entered everybody's vocabulary, because those are the two first vaccines that rolled out. Moving over to the top right quadrant, where it says viral vector vaccines, these use a slightly different technology. They use a virus vector or delivery mechanism to introduce a bit of genetic material into cells, which your immune system learns to identify and then overcome. And so companies like AstraZeneca and now Johnson & Johnson, which is the new kid on the block in terms of vaccines, both use this type of approach. Going to the bottom left-hand corner, the subunit vaccines, they are a bit more traditional. And they basically deliver ground-up virus fragments. They could either be the dead husk of a virus or bits of viral protein that, again, are just kind of shredded and injected into you. These pieces of virus cannot reproduce or replicate or cause infection. They simply, again, trigger your immune system to respond in the event that you actually are exposed to the virus later. Then the final category is in the bottom right-hand corner. These are weakened or inactivated viruses. And these are an older approach. Again, the virus itself, which has been weakened or crippled, is injected into an individual in such a manner that it doesn't cause infection, but it too works to trigger an immune response. All right, let's move on to the next slide, please. So I know there are certainly lots of questions in the public mind about sort of the accelerated pace by which the vaccines were introduced. So let's take a little bit of time and look at how the development of COVID vaccine differed from traditional approaches. So there are basically two timelines demonstrated on the slide. At the very top, it says traditional development of vaccine. And then at the bottom, it's the SARS-CoV vaccine development time frame. So let's look at the top time frame. You'll see that, again, it indicates regular vaccine development, which can at times take a decade or more if you start from scratch, meaning have very little knowledge about the virus which you're trying to combat. And that includes the time necessary to conduct the basic research on the virus, vaccine trials, and then get it approved for use. Looking at the bottom time frame, which is specific to the COVID vaccine, we already actually had a lot of background science from studying other diseases caused by different types of coronaviruses. This includes the SARS, S-A-R-S, or sudden acute respiratory syndrome virus, or the MERS, M-E-R-S, the Middle East respiratory syndrome virus. That data, that information, the scientific research went into informing the development of the COVID vaccine So another point is that the overall time frame for the clinical trials was reduced because the time frames for the individual phases were overlapped. And this is depicted in that more central portion with the little colorful boxes there that indicate the safety phases of the efficacy phases. We'll talk a little bit more about that later. They were very robust trials in terms of numbers of participants, and they overlapped some. The final point I want to make with regard to kind of the speed at which these development for the COVID vaccine was undertaken was the huge time-saving difference that came from starting vaccine production while the clinical trials were actually going on. So because of that, companies could take the risk of producing vaccine even before they passed all the necessary safety and effectiveness trials, because the government covered the costs even if the vaccine failed. So this meant, and what we have seen, is that there could be vaccine stockpiled. And when a vaccine candidate made it through all the necessary regulatory steps, it could be made available to the public immediately. And then finally, the vaccine candidates then go through federal review before being released for public use. All right, let's move on to the next slide, please. So we'll talk a little bit about vaccine safety and effectiveness. But first, vaccine efficacy or effectiveness is a measure of how much vaccine protects a person who gets vaccinated with it compared to somebody who doesn't. Both the Pfizer and Moderna vaccines show very impressive high levels of efficacy. 95%, and 94 to 95% for those. The Johnson & Johnson vaccine shows a lower efficacy value. I think 66% is what's being referred to in the literature. I've seen 72%, sort of depending on who you read. But the J&J vaccine is equally effective as the other two vaccines where it counts, in that it protects just as well against severe illness and death. Where its efficacy differs and where it has that lower value is in studies comparing it to its response against milder forms of illness. It isn't as effective in those circumstances, but again, it is effective equally where it does count. Now, for all three vaccines, their level of protection spans all ages, races, and ethnic groups that were tested. And you know, a comparison that I do like to make is when you look at the flu vaccine, which sits around 50% in a good year, seeing a vaccine that shows these levels of efficacy is really remarkable. And so far, these vaccines have demonstrated a very high level of safety in clinical trials since they've been made available to the public. Now, as I mentioned earlier, safety evaluations were conducted during the trials when they were being tested. Right before they were made available, the federal government reviewed all the available evidence from these studies and then issued what's known as an emergency use authorization, allowing each vaccine to be made available, which is essentially another safety check. And then there's continuous monitoring of these vaccines going on now, which is, I guess in official terms, called phase 4 trials. And then to date, there have been no significant safety concerns that have been issued for these vaccines. Okay, let's move on to the next slide, please. So talking very briefly about the vaccines themselves. For the Johnson & Johnson vaccine, only 1 dose is required. For both the Pfizer and Moderna vaccines, 2 doses are needed for those timeframes that are indicated. So 21 days between doses for Pfizer and 28 days between doses for Moderna. Now, the CDC has issued guidance that the second dose for both of these vaccines can be delayed for up to 6 weeks or 42 days if a delay is unavoidable. And the delay should not affect either the effectiveness or safety of either vaccine. Now, for both of the Pfizer and Moderna doses, vaccines, it's important to note that you must get the same type of vaccine for both doses. You simply cannot mix and match those. And for all of these, all 3 of these vaccines, the most common side effects include some pain at the injection site, as well as some fatigue. Some folks experience low-grade fevers. And what we've typically noticed is that with the second dose of either the Pfizer or the Moderna, there is a bit more of an exaggerated side effect profile. All right, let's move on to the next slide, please. Okay, so for these different types of vaccines, who should get them? So for Pfizer, anyone 16 years old or older. For the Moderna and Johnson & Johnson vaccines, anyone 18 years old or older. So far, neither one of these vaccines has been authorized for children and adolescents who are under 16 for Pfizer and certainly under 18 for the other 2. There are, however, ongoing trials in pediatric populations to determine whether or not these and other vaccines that are in the pipeline would be appropriate for children. Pregnant and lactating women can take it, as well as those who are considering becoming pregnant. And there are very, very few medical reasons that should prevent someone from receiving a vaccine. However, if you're in doubt, it's always the best course of action to consult with your healthcare provider. And in the next slide, I'm going to address some of the precautions to receiving one of these vaccines. So let's go there. All right, thank you. So this chart was updated fairly recently when the Johnson & Johnson vaccine came out, and it provides guidance on who should not get the vaccine. That's in the red section. We'll get to that in a moment. Who should proceed with caution when considering receiving a vaccine. That's the yellow section. And who can just go ahead and get the vaccine. That's in the green section. So what I'm about to share applies to all 3 of the currently available vaccines. So let's head back to the red section on the far left and consider that first. So again, these are folks who should not get a COVID vaccine. And you'll see the following contraindications. That means kind of reasons to not get it. If indeed you've had a severe allergic reaction after a previous dose or component of the vaccine. So this is again specific to the Pfizer or Moderna vaccine. And typically a severe reaction requires medical intervention. That's sort of how you define it. Or an immediate allergic reaction of any severity after a previous dose, or a known allergy to a component of the vaccine. We'll talk about that in a moment. Shifting over to the yellow section or precaution section. So this includes individuals who have either had an immediate allergic reaction to any other vaccine or injectable therapies. And it's important to note here that people who can't take one type of vaccine because of a contraindication, again in the red section, might be eligible to take another type of vaccine, but will need to consult with an allergist. So it's possible for those who might not be able to take one of the mRNA, that's the Pfizer or Moderna vaccines. They could take the Johnson & Johnson vaccine or vice versa, but it's very important to speak with a healthcare professional before doing so. And then finally, moving over to the green section, this section lists those who should get a vaccine without much concern. And you'll notice there that it lists many types of allergies. And indeed, you can get one of these vaccines even if you have allergies to those things listed: oral medications, a history of food, pet, or insect allergies, or even a family history of allergies. An important thing to note is that you should be prepared to stay on site after your injection, regardless of whether you have ever had allergies or not. We ask that folks be there for 15 minutes at minimum for anyone who's getting a shot, and then 30 minutes for those individuals who have had a previous severe allergic response to food or medications in the past. All right, let's move on to the next slide. I basically put this up there just so folks would have an idea of what's actually in these vaccines. And you'll see all three of the vaccines are listed up at the top. And in the columns underneath each of those, you'll see the respective ingredients. You can see the active ingredients, the very top row, which are simply the different genetic materials, RNA, or the viral vector for the Johnson & Johnson vaccine. And then there are a number of inactive ingredients, which include lipid or fat molecules to move the active ingredients to where they need to go, as well as a number of different chemical stabilizers, such as salts, sugars, and buffers. So what I do want to do is draw your attention to the red box, which lists a component that some individuals actually can have an allergic response to. And this lists polyethylene glycol, which can be found in the Pfizer and the Moderna. In the Moderna, it's abbreviated as PEG. That's the very first thing listed in that red box there. Or polysorbate, which you'll see in the Johnson & Johnson. Janssen is simply the company that makes the Johnson & Johnson vaccine. People who are allergic to these substances should not get the vaccine, or at the very least, speak to their doctor before getting vaccinated. So talk a little bit about what these things are, the polyethylene glycol and polysorbate. It turns out that they're actually pretty commonly found in a lot of medications. They're actually inactive ingredients in medications, binders and such. They're also the primary ingredient in osmotic laxatives and oral bowel preparations for colonoscopy procedures. They're used in a process called pegylation, which is to improve the therapeutic activity of some medications. So they're out there, and I think the basic notion is that folks who are potentially allergic to them probably have been exposed to these things in the past, and so they're not considered a great risk to the overall population, in other words. All right, let's move on to the next slide. Okay, so let's talk a little bit about some important ways you can get prepared for when you get your vaccine. Before receiving your vaccine, it's good to know whether or not it's recommended for you and where you are on that quote-unquote list. It's always good to get some more information about the vaccine themselves, and hopefully I'm providing you some of that right now. And then learn about the obvious risks and benefits of getting the vaccination. So when you're getting vaccinated, please wear your mask. After your shot, you should receive information about the vaccine itself, a printout card that tells you the date you received it, where you received it. And then, of course, as I mentioned earlier, be prepared to wait for 15 minutes at least after you get your shot to be monitored for side effects. It could be 30 minutes again if you've had a history of allergic responses. All right, let's move on to the next slide, please. So after being vaccinated, you might need 2 shots again if you got either the Pfizer or Moderna vaccine. There is an electronic product called BSafe, which is a free smartphone-based tool that checks in with you after you receive the COVID-19 vaccination. It also provides reminders about second doses. And then finally, again, you might have some side effects, which are normal. It shows that your body is responding appropriately in an immune response fashion. But always, if you know your body well, contact your healthcare provider if you have concerns about the degree of your response. All right, so moving on to the next slide, please. What I want to do is shift gears now and talk about kind of the vaccine distribution process, again, more big picture wise, and then sort of the planning here at the state level some, and then more importantly at the local health district level. So with regard to vaccine distribution, vaccines, of course, as you know, are developed and produced by pharmaceutical companies. The transportation has been handled by Operation Warp Speed to states. In Virginia, the Virginia Department of Health is currently responsible for allocating what is a very limited but fortunately a growing supply of vaccine to localities, who then, of course, manage vaccine administration. And doses that are given to localities, and here in Virginia, by locality, I'm referring to health district. That's kind of the Virginia Department of Health geographic architecture. So the health district that if you live in Chesterfield County, Powhatan County, or Colonial Heights, it's called the Virginia Department of Health Chesterfield Health District. So we cover 3 localities. So doses are allocated with respect to population size in these health districts. So ultimately, who distributes the vaccine at the locality level? Now, for the initial phase of the vaccine rollout, which was aimed at healthcare personnel, that's way back when we were using the 1A term, the primary recipients were hospital systems and health districts. So the original plan was predicated on healthcare systems managing the heavy lift of vaccinating 1A individuals, with health departments serving a support role. There had been variable response by health systems across the state. And here in the central region, which is kind of the greater Richmond area and a bit beyond, health departments have had to assume the primary role of vaccinating healthcare personnel not affiliated with healthcare systems. There is now a growing list of pharmacy partners and providers to whom we can distribute vaccine to dispense. And so we're also working very, very closely with local governments who are able to vaccinate employees who fit the essential worker categories. So another important question is, how do we determine who gets vaccinated? So expecting that vaccine supplies would be low, again, in the early stages of the rollout. You recall way back when I was talking about the trials and the timeframes and the fact that we were able to accelerate this particular vaccine production because we could stockpile it. We knew initially that stockpile would dwindle until production caught up. The federal government, the Advisory Committee on Immunization Practices, established priority groups based on the risk of adverse events from contracting COVID-19, or the risk, depending on your job, if you're in critical infrastructure, to severely affecting a critical industry, healthcare, for example, if a number of employees got ill or were exposed. So the broader 1A, 1B, and 1C groups were established, and the Virginia Department of Health further defined who would be eligible by subcategory. So these categories have changed over time and are noted on this slide here. So, this particular graphic shows the early phases of vaccine eligibility in Virginia. That's the 1A and 1B. We're currently still in that early phase. Vaccinating in the 1A phase began in mid to late December. And again, as I mentioned, this was through hospital systems, local governments, and health departments. And another important group that was vaccinated in 1A were residents of long-term care facilities. And probably heard of the federal partnership involving CVS and Walgreens. And then movement into the 1B category started roughly the middle of January, actually January the 18th, with the governor announcing the transition the week before. So this movement into 1B opened up eligibility to about half the state's population. So health districts, and again here, Powhatan County, City of Colonial Heights, and Chesterfield County have the latitude in directing vaccines to specific populations based on vulnerability because of the limited supply. So until this past Monday, that's March the 8th, we were directing vaccine at our most vulnerable senior populations, and these are individuals 75 years old and older, and those who are 65 and older with underlying health conditions. And we were also vaccinating the top 3 tiers of essential workers. I'll talk a little bit more about that in a moment, so why don't we just go ahead to the next slide, please. So after, again, several weeks of limited supply, I'm happy to report that our vaccine allocation is increasing. Our allocation for this week included over 15,000 first and second doses of vaccine, which is an increase over last week's allocation of about 13,500. About 12,000 out of that 15,000 doses are first doses. And this is up from 10,000 first doses last week. And this is wonderful compared to where we were a month ago, where we had just 4,500 doses per week coming into this health district that had to be, again, directed. And much of that was directed to our seniors, vulnerable seniors, and essential workers. Now, we are expecting our allocation to increase on a week-by-week basis. I wish I had a good fix on what that would be right now. We're really subject to kind of the federal government's supply allocation, and then that kind of filters down to my VDH leads at the state level. But we typically find out with a little bit of advance notice, and then we scramble to get that vaccine to our various distribution methods. So our strategy team felt that we were poised to offer vaccine to a wider range of population within the phase 1B priority group. And I mentioned earlier that these groups are established by the government. And as of this past Monday, we broadened our distribution of vaccine to include seniors 65 and older. Again, we were limiting it to 75 and older, and those 65 and older with underlying health conditions. And we've fortunately found that we've covered a lot of ground within these latter 2 groups. However, there are still individuals who need to vaccinate. We're moving broader and more deeply in the senior population. And we want to cover ground there more quickly. So we're dedicating about 70% of the vaccines that are coming in right now to our vulnerable seniors. And then I don't want to forget our essential worker categories. So we've also expanded now to 3 additional groups within the 1B essential worker category. So we've added food and agricultural workers, which include veterinarians, manufacturing workers, and grocery store workers. And on the slide, you can see all 6 of the essential worker categories that we're addressing right now. And so 30% of our vaccine is headed in that direction. Now, I am aware that members of the clergy and faith leaders were added to the 1B list a few weeks ago. They're currently number 10 on this prioritization list. I believe there are 11 groups on that list right now. Trusting that we will, with increased supply, be able to move more quickly through all of these groups. So please stay tuned. All right, let's move on to the next slide, please. All right, so this is really exciting and really brand new. I want to offer up the question, how is Chesterfield County doing in terms of vaccination response? And this is a great, I think, snapshot to see how we're doing with reference to other localities. And I believe this went live just today, and I'm referring to the Chesterfield COVID-19 dashboard, which provides real-time data pulled directly from VDH data sources. You can see that you can access it through the Chesterfield.gov website. And I'm just pulling one of the pages of that dashboard, which looks at localities with populations that are greater than 200,000 people. And so this is, again, Chesterfield County, and ranks them according to population percentage who have been vaccinated against a community vaccination goal of 75% of the potentially eligible people who can receive vaccine. So in this case, that's individuals who are 20 years old or older. And again, most of the folks who have been vaccinated have been usually over the age of 65. But this represents here in Chesterfield 190,000 individuals. And the same methodology has been applied to other localities for comparison purposes. And I'm really happy to say that Chesterfield County is listed second amongst localities in the state of this size. All right, let's move on to the next slide, please. So I think really a lot of the progress, certainly want to give a shout out to my colleagues here on the call from Chesterfield County. They have been incredible in supporting what I have described already as a novel thing, responding to a pandemic, and it's been a very, very challenging undertaking. So we certainly have welcomed the support and cooperation from Chesterfield County local government. We last month, on February 2nd, signed an MOU with the county that has made it possible to access the resources, the incredible talent available through the county government. That has really, really helped improve our vaccine distribution capabilities. I've got to say, over the past 2 to 3 weeks, it's just amazing how much improvement has happened. All right, we're in the home stretch, so let's talk a little bit about signing up for a vaccine. Again, certainly COVID remains a high priority for both the state, and I know certainly at the locality level that's true as well. And the state launched the Virginia COVID Information Center, and it's a way for residents and workers to be able to sign up into the pre-registration system, which will eventually get folks vaccinated through various different means. Provides equal access to all populations, provides language support. There are, I believe, over 750 agents with English and Spanish-speaking agents operating 7 days a week from 8 a.m. to 8 p.m. And there are other language services available as well to support folks. So connecting with the COVID Information Center, there are 2 ways, one of which is web-based or email, web-based. You can go to the vaccinate.virginia.gov website, or you can call the 1-877 Vaccine VA call center number. There's, in addition to registration, pre-registration support, there's all sorts of other information that's accessible through those 2 means. All right, so on the next 2 slides, I'm not going to spend much time here. Certainly peruse these at your leisure. There are some additional resources to learn more, to direct others you might be supporting, members of your faith communities, to these resources as well. So thank you again very much for your time and attention. I'll turn it back over to you, Emily.
Thank you, Dr. Samuel. It was really great information. If people, again, if you have questions, make sure to type them in the chat box. I will email this slideshow out, especially so you all can have the resources that were listed. So one of the we had kind of as you all registered was, what can the faith-based community do? How can you all partner with us, and how can you take all of this information you just heard and what from the county, and really your congregations trust you. And so one of the best things that you can do is promote people to sign up for the vaccination and promote the efficacy and the safety of the vaccination as much as possible that you can, and just encourage your members to be able to vaccinate. And also, if you have senior members that don't have access to technology or they find it very difficult, please help them register. And then also remind them to answer their phone calls. A lot of times we don't answer a phone call from a person we don't recognize the number from. And we try to teach our elders and our parents those things. And now we're telling them everything else against that, to be able to answer that phone call to get the message. And also, if you have seniors who have transportation issues, if you could kind of have like an on-call list of people who can be called to be able to give them a ride to the vaccine clinic and be able to sit there with them. We do like to boast that our turnaround time is very quick once you get to the center, and the biggest part there is that 15-minute wait time after you have the vaccine. So those are all ways that you can really help assist to be able to make sure to help your congregation get vaccinated and get the message out. So with that, we will also be able to answer some questions here. The first one is, do we plan to establish a massive vaccination center, or the supply is too limited? So I will
Excuse me, Emily,
yes.
before you go forward, could you stop sharing your PowerPoint and let's go back to the gallery setting to make everybody larger?
Oh, yeah, absolutely. I'm so sorry. I thought I was doing that. So there we go.
Thank you.
You all. Okay, yeah, thank you for pointing that out. I believe Teams did an update today. It's much different than I'm normally used to working with. So now that we're all back together as a family, instead of looking at a PowerPoint, we'll go through some of these questions. So the first one is Dr. Samuel will be able to answer this. I know there's been a lot of talk about it, but the massive vaccination centers are large pods, something that's bigger than what we've been doing at the fairgrounds. Yeah. It's more comparable to what Henrico's doing. The plans for that to open.
Yeah, that's a good question, and I don't know if I really mentioned the fairgrounds pod a whole lot. So yeah, we have here a site. I wouldn't call it a mass vaccination site, but I think it's appropriate to just kind of the strategy that we are deploying. So our county fairgrounds, the veterans building there, has served really remarkably well. And we typically hold about 4 to 5. These are invitation-only events. Again, we're targeting a specific population right now. So these individuals are pre-registered, then they're scheduled, and then they're directed to our fairground sites. 4 to 5 of these events with anywhere from 500 up to 1,000 individuals who go through those in a day. Now, with regard to the larger mass vaccination sites, I wouldn't say that that's currently part of our overall strategy. However, the state is planning to have a number of these kind of scattered throughout the Commonwealth. And there is the possibility that we're going to have one opening up in our vicinity in the near future. So there's still a lot of planning behind it that needs to be worked out. VSU has very generously offered their multi-purpose center as a potential location for that sort of thing. And it will be, again, a draw for residents of this health district, of the Crater Health District. Those are the two right now that are kind of earmarked for it. And then potentially kind of concentric circle outwards, pull from other nearby localities as well. So that's kind of in the works, and that's aiming for a point in time when certainly supply is greater, and as we get deeper into the pool of eligibles, certainly when we reach the general population at large, those are going to be more and more common in the Commonwealth.
Great, thank you, Dr. Samuel. And just like while we're still talking about vaccination sites and everything, there are interest in churches that want to become vaccination sites or going out into the community, having mobile sites. Is that a potential of things to be able to happen?
Yeah, that's a really good question. I mean, there are a number of factors that have to be worked out. Partly there are a lot of logistics and operational details that have to be put into play for it to stand up kind of a physical location. We are working on planning for mobile vaccination opportunities, and partly this is, an effort to be able to target our most vulnerable populations more effectively. And I think what we saw certainly with testing, what we saw with issues early on with greater incidence of COVID infection, burdening our Latinx and our African American communities, we really need to be able to provide vaccine more effectively, efficiently, and easily in those areas. So certainly, mobile opportunities, I think, are probably our first effort, but there is additional thought towards using pop-up models, which would be not necessarily occupying a building, perhaps even a church, for long periods of time over a week, but having maybe a 1 day a week sort of operation. So those are certainly in the realm of the possible. We simply haven't gotten there at this point to be able to set them up in a broader scale yet.
That kind of, talking about the equity and getting out into some of our lower income, kind of a follow-up question for that. How can the faith-based congregations, how can they help with low access folks in the area to make sure they have information they can sign up? Would it just be best to kind of canvas and get them to sign up through Vaccinate Virginia, or to encourage them to call Vaccinate Virginia? How can we make sure some of our lower income communities are getting signed up?
Yeah, I think absolutely. Those are great ways. I mean, that's probably the easiest way to get an individual visible to be vaccinated. And then certainly, being an information resource, there's a lot of information from VDH. I know that the county has created great resources as well, simply to inform and educate, and to, I think, dispel a lot of the myths and rumors about vaccines that are out there right now.
And along with being able to be advocates and everything, to be able to volunteer on site with different groups. I know the Medical Reserve Corps are all healthcare volunteers, but do you need extra volunteer help with registration, wheelchair assistance, driving golf carts, anything like that? Is there a sign-up genius that we can give to this group, or do you all have that handled?
Yeah, and I think one of the most amazing things, particularly as we've entered the vaccine phase of this response, is to see really the incredible community support around this. So the Medical Reserve Corps, MRC, that Emily referred to, is the Virginia Department of Health branch for volunteering. There are a number of individuals who are indeed, yes, healthcare personnel, and I want to give a shout out to those folks because we could not do this without them. Our primary core of vaccinators are MRC volunteers, but there are a number of different roles that MRC volunteers fill that don't require a medical background, and so there are avenues to sign up through the VDH website. I believe it is MRC. You can Google. I'm so sorry, I don't have the website at the top of my head, but the Virginia Medical Reserve Corps will direct you to the MRC. And then I know the county has resources as well, volunteer groups like CERT that are supporting our operations, doing much of the heavy work outside of the actual physical structure itself, the directing traffic, the helping folks get in and out of the building, wheelchair support, etc.
Okay, great. Thanks. This is a question I also have. If someone has been able to obtain the vaccine, can they remove their name off the list? If they've gone through Vaccinate in Virginia and register, they have the vaccine. If they got it through CVS or a different avenue, can they go and update and remove their name off the list?
That's a good question, and you know what? That should be happening automatically. So like so many facets of this response, many things are a work in progress. And one of those things is the pre-registration list, aspects of the pre-registration list. One of the things that we've discovered is that syncing the names on the list with the information system, the Virginia Immunization Information System, which is basically a record of folks who have gotten vaccinated, is improving. And that should be an automated process to actually remove folks who have gotten doses of vaccine from the pre-registration list. So there really is no reason for somebody to go in and do it physically. I am aware of folks who have been getting calls about different vaccination opportunities, and that can be frustrating. With time, however, that should go away.
Thank you. Okay, there's some chatter in the chat box. There's an event this weekend at Bon Air Baptist with a pharmacy that they're partnering with. So I think this, when you talk about, pharmacies that have the vaccination, how do people sign up for those? Is that something outside of the role of VDH, or are these pharmacies pulling from the VDH list?
Yeah, that's a really good question. So yes, I mean, we provide that VDH list to most of the pharmacies, and so we've had a little bit of challenge with the list, some of which I just described to you, and so some pharmacies have been I think proactive and contacting individuals who fit, again, sort of the priority profile, individuals who are 65 and older, and certainly those who are older, as well as have underlying health conditions, who more than likely are already on the list to get vaccine. And this is simply to speed up the process, expedite folks. We don't want things to be a barrier to get the vaccine out the door. So with respect to Bon Air Baptist, I really don't know their partnership or arrangement with the pharmacy. A lot of things I really am happy to say are happening sort of in a innovative basis. So there are pharmacies who are setting up pods, either using the pre-registration list or, as I described earlier, extending a little bit beyond that in terms of using their own resources, and creating pods to vaccinate folks so that they can be more efficient and effective in their distribution. So I'm afraid I can't answer that question specifically about Bon Air Baptist.
Okay. And then the question came up, can we share the slideshow with the members? Yeah, there is nothing in this. Well, the slideshow that we've given tonight, I will email it out to all of you, so you'll be able to have it, and feel free to share it and spread it. And later, probably next week, we'll have it posted on our county website, and of course the recording of the meeting as well will be posted there as well. So yes, please share all of this information. Like we said, though, it does update quickly. It rapidly changes. So make sure that there's also a date of when you're sharing a timestamp, so people know that they're looking at the most recent, latest information. Are there any questions? Are there any questions from people who have called in that aren't able to chat in the chat box? We have a couple more minutes here. We can take a couple more questions. Okay, hopefully this presentation has been useful for you all. Again, we're just so thankful for the partnership. We're so thankful for everything that you all do for our community and that you do for your congregations. This is a team effort for everyone, and we're just so appreciative of the role that you all play. Dr. Worsley, do you have some words?
I just wanted to say there may be some people that may be calling in and not necessarily on a computer, so feel free to unmute yourself and ask your question or make your comment.
And also, if you go tonight and you start marinating on this information, please reach out to us. We'll get the answers. We want to be as transparent as possible. We know that you all getting the best information. So if you think of a question later on, feel free to email and we will track down the correct answer for you. I put my email there in the chat box for that. Okay, well, Dr. Samuel, thank you for taking your time to present to us tonight and being here with the group.
My pleasure. Thank you all again for the work that you're doing.
Okay, and with that, we'll conclude this community conversation. Thank you all for participating.